RBCs contain hemoglobin. This hemoglobin contains 2 alpha chains and 2 beta chains. Genes for these 2 alpha chains is found on chromosome 16 and genes for these beta chains are found on chromosome 11. Sometimes there is hereditary cases of mutation at specific location of chromosome number 11, and when this mutated immature RBC grows up and becomes mature RBC, the gene mutation manifests itself by replacement of normal glutamic acid with abnormal valine in the defective beta chain. As a result, when this abnormal hemoglobin faces critical conditions such as dehydration and acidosis, it polymerizes and forms a structure which is something looks like sickle, and overall RBC becomes sickle shaped. That is why it is called sickle cell crisis. And these sickle cells, when they undergo frequent polymerization and depolymerization, they undergoes membrane disruption, which causes rupture of RBCs inside spleen. And this results in splenomegaly, and with the passage of time the spleen become infarct, fibrosed and shrinked, which results in autosplenectomy. These ruptured RBCs release hemoglobin, which is converted into its final product, which is bilirubin, which accumulates inside the gallbladder and forms gallstones. And due to hemolysis and low lifespan of RBCs, bone marrow tries to form more RBCs, which causes marrow erythroid hyperplasia. And still, erythroid formation in normal bone marrow is not enough to meet the required demand of RBCs. As a result, there is formation of RBCs outside the normal bone marrow, such as skull bones, and this process is known as extramedullary hematopoiesis, and this results in sickle cell anemia. When these sickle cells pass through the blood vessels, they cannot make their way through these blood vessels. As a result, there is accumulation of RBCs and blockage of this blood vessel, which causes the infarction of organ supplied by this blood vessel. So the organ damage is present. So now let's talk about the histological slide of sickle cell anemia. This is the histological illustration. Now you see, these are the normal RBCs. These are the sickle shaped cells. As you can see, these looks like sickle, and these specific cells are target cells. The exact cause of formation of these target cells is not known, but due to abnormal hemoglobin chain, the biconcave shape of RBCs shows a central bulge, which causes these cells to look like a target. That's why it is called target cells. And there is a purplish body inside normal RBCs, which is called Howell-Jolly bodies. These are the fragments of nucleus which should be removed by spleen, but the spleen here is infarcted, so these fragments of nuclei is not removed and they are still present in these cells. So these forms Howell-Jolly bodies. And here you see the reticulocyte, because there is considerable amount of reticulocytosis in sickle cell anemia. And here is the real histological slide. These are the normal RBCs, these are sickle cells, these are immature RBCs, and these are the target cells. And here you see the reticulocyte. For quick revision of this topic, check out our notes in the description below. And for the gross features, patients show erythroid marrow hyperplasia, extramedullary hematopoiesis. For example, the formation of RBCs inside skull, which causes crew-cut-like appearance on radiograph. Look at this. There is formation of gallstones, the spleen is enlarged, and with the passage of time, it shrinked and fibrosed, which is known as autosplenectomy. And there is infarction in bones, brain, kidney, liver, eyes, and blood vessels due to blockage of capillaries by these sickle cells in these organs. And that was all about sickle cell anemia.